Matthew Perry. How are you?
Hey, Brianne, I'm doing wonderful today. New year, new us, right? Something like that. Yeah. Hopefully, 2022 is going to be a much better, more fruitful year than the past couple.
Who knows in this day and age? Who knows?
Everyone calls me the eternal optimist, but it's like, hey, if you don't just laugh at it, you might cry. So let's just let's just laugh.
There we go. There we go. Awesome. Well, hey, I'm excited to talk to you. It's been, I think in podcast world, it won't have been a real long time since our last interview, but in our actual world, it's been a while since we've connected. So I'm excited to dive into more fun stuff today. And I think what we really want to focus on today is the back. And I know we could go a ton of different directions on this, but kind of going along that direction of like, when people are being told they have a weak spine or an unstable spine or all of these, whatever word you want to put on it, like, what does this mean, or does it really mean anything?
Yeah, that's a great point that we can jump off on. Yeah, it's really interesting. We have this healthcare system that is designed to make sure we detect every little impairment that we have in our body through imaging and things like that. And it's really it's a marvel. I mean, first of all, it's amazing that we have that, but yeah, it can also kind of sometimes we get a little bit too much in the weeds with stuff and find things that maybe aren't that significant, right? And this isn't all the time. Like, I'm not knocking, imaging at all. Don't yell at me yet. Give it time.
Yes,
The rest of
yes,
the
you will.
podcast. But yeah, these all of these things like arthritis, degeneration, and all of that. I have yet to see anybody come through with a clean bill of health on an image, right? I don't know what your experience is with that, but everyone I see has a degeneration, arthritis, all that stuff, right?
Oh, absolutely. Like, you take anyone over the age of probably 25 and they're going to at least show something. I mean, we've done stuff, we've played sports, we've fallen from trees. Like,
Hopefully,
who
right?
knows
If
what we
we
can
if,
do?
if we lived a good childhood, we have.
Right? Absolutely. Absolutely.
But yeah, it's really important that we discern, what is significant and what is life, right? What is wear and tear? I have no doubt, I've shared my backstory and my herniated discs in my back before, but I'm sure I have arthritis and degeneration in my shoulders, right? I've never really had shoulder pain before. Actually, that's not quite truthful because I separated my shoulder playing rugby a few years ago, and but sorry, my right shoulder, the separated shoulder, is actually stronger than my other shoulder for some reason, although I have less stability. We really need to make sure that in the healthcare community we're giving people accurate information. We're not lying. However, we also need to have that caveat that you might have this. However, this is a normal sign of blank of aging or of life, right?
Absolutely. And that it brings back I was talking to actually a former client of mine. I talked to her in passing at the gym the other day, and long story short, she had neck stuff several years ago, like causing weakness, numbness, tingling down the arm, required surgery. Everything's been great. She's starting to get a little bit of symptoms again, which I talked to her. I was like, I think it's just the muscles that are like, now you're getting trigger points, you're using the muscles again. But for ease of mind, she wanted to get another scan, which is totally fine. And she's like, came up totally clear. And she's like, in fact, she's like, there's like showing nothing, like no tears, no damage at all in my shoulders. Like, they look great. She's like, except showed a little bit of AC joint impingement or inflammation. And I was like, but I was like, with the workouts you do, who says there wasn't the same thing on the other side? She's like, exactly.
Yeah.
So you
And
have to take so many things into account, I think, when we're looking at these scans.
exactly. And what I don't really like is people with, we'll call it although everyone's unique, general quote unquote back pain, nothing traumatic or anything like that, come into me and are telling me, oh yeah, my spine's weak. My spine is, in disrepair. It's the worst one I've ever seen. We've talked about that before. And yes, that obviously for some people can be true, and we're all born differently and have different things, scoliosis, etc. But for the vast majority of us, we don't have a weak spine, right? Because if we had a weak spine that shifted or something like that on us every time we moved, we would probably have a little bit more than mild back pain, right?
Most likely.
Most likely, right? We wouldn't be able to walk. We would have loss of function in our bowels and bladder. We have all of those significant things, and some people do, and that is obviously a medical emergency. But many of us, we just need to work on some movement and some control in order to make sure that our spine is nice and stable, right?
Yeah, I think it's, and it can come down to just semantics of how things are worded and thought about, but like there's a big difference between someone having a quote unquote weak spine and someone just not knowing how to control their body through movement patterns to actually do what they need to do or want to do to function.
Yes, most of us have movement problems and not necessarily structural problems. So it's always important, and I always encourage people to get a second opinion from somebody, right? Because one, the medical system is way too overrun and all that, and that's no fault of the doctors or anything like that. They don't always have the ability to share, yes, this is arthritic or has arthritis or degeneration, but that's okay. They can't get to that point because they're running to their next patient because of productivity standards, et cetera. But that's why, I love what we do. We spend time really kind of dissecting stuff and looking at the x-rays and the MRIs and giving our input based off what we're seeing. Because let's not forget, y'all, we have strong ligaments that are designed to keep our spine in place, right? What most of us lack is the control in our muscles when we turn, when we bend, pick up that piece of paper, and our back goes out. So it's about what is the weakness or what is the incoordination.
Yeah. So let's dive into that a little bit. Like when that person twists or bends down to pick up that pencil that was the final straw of like finally causing a problem, like what's actually happening? Like if the spine's not weak, what's actually happening in that area to trigger the pain that comes on?
Yeah, that's a great point. I love trying to dive deep into what could be causing my patients issues. And this is from my perspective. We all have different perspectives on it. But what is happening is that your muscles are not engaging at the right time. I don't always go straight to weakness. I go to incoordination, right? So it's like, what's the fastest way to get from California to Denver? It's fly on a plane, go east, right? And that's what we want our muscles to do. But what's actually happening for some of us who have these control issues is the flight's going north to Vancouver, east to Toronto, then southwest to Denver, right?
Sadly, we see those flight paths sometimes.
We do see the flight paths. Absolutely. I've been on some of those flights, unfortunately.
Right.
But what we want to do is just is make sure that the muscles are turning on at the right time, because when that doesn't happen, because our spine isn't we've talked about stability, but it isn't a completely stable structure. It's not rigid, right? It's designed to move and rotate along with our bodies. But when that doesn't happen in a controlled manner, the nerve roots get pinched. The body goes, uh-oh, what's going on with me? Senses danger and seizes up, right? It's like me shrugging my shoulders really, really tight and, that kind of thing in traffic. It's that same kind of thing, but happening in the back is kind of my analogy.
Mm-hmm. No, and that's a great point. Like Or, I think that's a really good analogy there as far as what's happening in that area, things just tightening up. Like we aren't necessarily, do disc issues happen and pinched nerves? Absolutely. Like we've seen it, like surgery's required sometimes, like it totally happens. But most of the time, like it's not a disc issue. Like it's just a muscle. Most times it's just a muscle issue. Um, what that brought to mind though, as you were talking, is talking about like motor control, movement patterns. Something I've had a lot of fun playing around with lately, and it was part of because of what I've just been playing around with myself, trying to figure it out, is how to like keep that neutral spine position or a better position so we aren't like getting into that like extreme lordotic thoracic or extremely lordotic lumbar spine when we're going into extension, and how we can control that without like doing it all at the pelvis. So playing around with like, how do I control the rib cage? How do I control all that spinal area with these different positions, going overhead, standing up tall? And um, both with just kind of myself, I kind of got into it, but it's been really eye-opening for a lot of people I've worked with. All of a sudden they're like, oh, no wonder I can't do X, Y, and Z without constantly injuring myself. Like I can't even get into this position.
Yes. And that's why the first thing I do if someone comes in with back pain, it's like, okay, let's see how you're activating your core. And we'll dissect the core in just a moment because it's a lot more than just your abs, as you were alluding to, Brianne. But when they're on their back and I tell them to try to, tuck their ribs, as well as maybe a small pelvic tilt depending on the person, but definitely tucking their ribs and flattening their back to my hand, which is a cue under them, and they can't do that. It's like, well, how do you expect to be doing that at any point in the real world when you're moving? And so that's just showing a huge movement and coordination that needs to get addressed because, yeah, they are going into that hyperextension, that extreme lordotic curve when they're deadlifting or doing something else, most likely.
Mm-hmm. Absolutely.
But yeah, let's talk about the core a little bit because we throw around that term all the time. I've never been to a gym where they didn't say, turn on your core, right? Just activate it, as if it's just a simple thing. But as I as I said a minute ago, some people can't even do that while they're flat on their back. So how are they going to do that during a deadlift? But just to go over the core, in my opinion, I think the core is so much more than just your abs, right? We have our thoracolumbar fascia and all of our transverse fascia that goes into our back, so it intertwines with our back muscles. When I tell somebody to activate their core, brace, whatever the case is, we do create kind of a ring, almost like a weight belt that you see in the gym. And I try to dissuade people from using the weight belt because we kind of have a built-in one to an extent. But let's not even stop there. Let's go to the roof of our core, which is our diaphragm, right? A primary muscle of inspiration. That needs to descend, and your pelvic floor needs to elevate. A lot of ladies have pelvic floor dysfunctions because of pregnancy and things like that. And if one of those systems aren't working, if the diaphragm's not distending, you're not creating that ring around you, and the pelvic floor is not raising, then you have a break in the system. And that's where I see a lot of issues kind of coming from.
Mm-hmm. And I personally, I think you can go even more. Like whenever I think core, like I think actually from like basically your shoulders all the way down to kind of like knee-ish area. Because if we aren't thinking about like, well, your lats, they connect to the top of your pelvis, they connect to your shoulder blades. The entire spine essentially is all connected from the top of your neck to the bottom of your spine. Um, everything in that surrounds the hips, like that has to kick in to control the hips and the pelvic position and everything. So like when we're talking core, we aren't just talking those six-pack abs. In my opinion, we aren't just talking everything between that diaphragm and pelvic floor. We're really talking about the majority of your body.
Absolutely. And yeah, let's talk about the shoulders needing to kind of be down and back, maybe a 5% kind of thing to activate the lats. I love that. Let's even talk about the feet, right? I know.
Absolutely.
So I mean, I love that. Let's really talk about your whole body being your core. And if you have any issue in any of these systems, then the core is not going to work in the way it should.
Hmm. Yeah, definitely. So what sort of things do you do when you are, just continue using the word, when you are training core, like when someone comes to you and you need to start like doing some core work with them for job purposes or workout purposes, like what sort of things are you, and obviously everyone's a little bit different based on where they, what they can do, but like obviously you and I are not doing the standard like ab core exercises. So like what sort of things are you doing with people to really challenge that?
You mean you're not doing crunches to activate the core for every person?
Secrets out, darn it.
um, it depends. No. But yeah, when I take a person in our evaluation process, I love to see what they do in everyday life. If they're a construction worker, that is a completely different thing than someone who sits at an office all day. But we really get to the bottom of what the demands are in their life, but also uh, when they're moving, it's what's the quality of motion in some of those areas. And so a desk worker, we have them probably hip hinging, deadlifting. I love starting with a good morning once we're kind of off the back stuff, or them being on their back, just to kind of relearn. Because as soon as I teach someone a hip hinge, the first thing they want to do is just reach down towards their toes. And that's okay in some aspects, but if you're trying to lift something heavy from the ground, probably not the best way to do it. So it's very very function specific, but everyone gets some form of, like I said, that hip hinging, progressing to lifting something from the ground, right? Because that's probably what injured their back in the first place, based off whatever they told me.
Yeah, and I think bringing in the, or what you were saying as far as like people round forward, and this is even where it sticks out even more as far as how important the shoulders are to the core, not necessarily from a strength perspective, just from a positioning perspective. Because and I do this with all my people who it's like, okay, do a hip hinge and they round their shoulders, is like, all right, now keep your shoulders back in that position and stand up, and like helping them like really see and feel the difference on like what's happening on a spinal level when they keep their shoulders back and how less it has to activate um, and do the job to stand up when they do that.
Yeah, and probably how much more powerful they feel too,
Mm-hmm.
right? Because you can generate a lot more power when the muscles are on versus when they're, in a passive state. And then, then they'll see that kind of jerk from the ground, right? Well, you don't need to do all that, right? If you keep the muscles on as you lower to lift or whatever, then you're good. You shouldn't need to do any of that.
Yeah.
That's yeah, I mean that's great, and that really is this whole thing. We always throw around that term function. Everything's functional now. Hashtag function. But how many of us are really making sure we're getting to the bottom of what's functional for them? It has nothing to do with what I think, right? It has everything to do with them. If they're going for if they're a bodybuilder and going for a max deadlift, we have to train probably some improper form, because they're not going to have 100% form during that max deadlift. And that's just life. That's just how it is, right?
Oh, absolutely. And I think that's why, we, whether we want to get into the whole Jefferson curl debate or not, but I'm like, that's like situations like that. And even all situations in life, like I think it's important to also teach the spine how to actually control itself in those rounded positions. Cause like, think the mom getting the baby from the crib, like you can't hip hinge and get yourself over. Well, okay, maybe if you're taller, you can. When you're 5'2", you definitely can't.
Nor 5'7" like me.
You can't do a good hip hinge to like get your child out of that crib or reaching into the trunk to get stuff out. Like there are times that's like you just can't hold that position. So, doing Jefferson curls or things to still teach the body how to maintain a rounded spine, be small, be strong, control that, I think is super important too.
Yeah, 100. Because if we're training someone to do a barbell deadlift in the gym in this perfect form, picturesque, you put it on Instagram, like that kind of form, but they never really live barbells in their life, and they need to do something like what you said, then we're not training them in the best way possible. So yeah, it's always very person specific. I'm also thinking of like, you ever like, I'm sure you've moved a few times, so like lifting a couch.
Hmm.
How can you do that with quote unquote perfect form? It is impossible. It is impossible.
Truth.
Sorry, I can't speak in absolutes because someone's going to say it is possible and send me a video of it. But like, but seriously, right? It's very very hard to do with a completely neutral spine. So yeah, we should train people for that, especially if they're a mover, especially if they are moving.
Hmm.
So that's absolutely perfect.
And on that same note too, like, how often are people told you shouldn't lift and rotate?
Mm,
Like, same thing, like
yep.
try moving and loading a truck or loading a storage unit without having to do some sort of rotation because of where things are situated or the awkwardness of an object.
Yeah. I had an intern last week or a couple weeks ago, and she's in her undergrad, but she's taken some anatomy classes and stuff like that. And I had an elderly patient. He was doing some rotational exercises, and the intern was like, "Hey Matthew, I don't mean to challenge you or anything, but I always accept challenge, and all that." But yeah, she was like, "I was told that elderly people shouldn't be rotating because that's bad for their back." And I'm like, "Okay, this would be a great learning moment." And so I had my client. We put a kettlebell or something in his trunk and told him to get it out of his trunk. There had to be rotation, right? And so if we think that people are just living in this vacuum, like this robotic like system, it's absolutely false. It's patently false, because we have to rotate. We have to, do different things. We have to side bend in order to pick stuff up in everyday life.
I'm pretty sure there's a reason they told us we had three planes of movement when we
Right.
were in school, right?
Yeah, yeah. Not two, not one,
We're allowed to
three.
rotate.
It's okay. But we're kind of bred to believe some of these things, and I think I get where they were coming from with it.
Hmm.
I don't want to say they're wrong by any means, but in the real world, it's not textbook. We have to train funky motions. When I have my basketball players coming out with back pain, when we're practicing jumps with me kind of leaning into them a little bit, pushing them a little bit, because that's what happens on the court, right? Awkward movements of rebounding. That's not picture perfect by any means, if you watch the NBA. But they have that ability to control it.
Hmm. And then, and obviously there's a limit. You're not going to start anyone, regardless of their age, on a like, hey, let's pick up this 150-pound object and rotate with it. Like, I wouldn't even do that
Russian
with
twist.
someone in a straight plane lifting if they had never lifted something that heavy in their life.
Hmm.
Like everything's relative to everything else. Like you're gonna, regardless of the movement in general, you'll injure yourself if you're lifting more than what your body can handle.
Yeah, if your load is exceeding your capacity to move that load. So yes, it has to be properly dosed, absolutely, and has to be built up, right? Because if I do have that same, elderly person, this intern didn't see that, but we had also worked in uniplanar, single plane movements, for the first couple sessions, just to build up his one confidence and also kind of tissue tolerance to make sure that he was able to then handle the progressions of that.
Mhm.
So yeah, it's another point to don't always take a snapshot of something and think that that is the whole picture, right?
Oh, absolutely, absolutely. And I think it's tough. Like, well, there's a lot of downfalls of social media, but that is one of the tough things. Is you know people see a strong athlete or they see a PT doing something with or a coach doing something with someone and like, oh, that looks awesome. I should go do that. It's like you didn't see the 15 other progressive exercises that led up to that point to be able to do that. And so there's just like it's great that some of these things are out there, but at the same time, I don't think there's enough out there to like don't do this if X, Y, and Z aren't already in place.
Yes. And mind you, that person has also been training 20, 25 years to get to that point to be able
Hmm.
to do something like that. I mean, so yes, it's the short term before and the long term before. And yeah, we see the person, you know, juggling kettlebells while like shoulder pressing 150 pounds all while on one leg on a Bosu ball or something like that. um, and maybe something like that is a bit reckless. I don't know the function behind it, but yeah, we need to look at them. We need to look at ourselves and be like, okay, well, think of it critically, right? I'm not a professional athlete. I don't get paid millions of dollars to simply train. So maybe they have some skills that I don't possess right now.
Hmm. Yeah, absolutely. What are So we've talked a lot about just kind of like spine strength and all of this and just kind of training the core. Obviously, in life with the body, like not everything is like perfectly treatable by just therapy or doing that conservative route. What are some instances, just speaking specifically on the spine, like what are some occasions that, you know what, it's just not going to work to do therapy, like, and surgery does have to happen?
Yes, that is an absolute reality, in our business. And I'd love to say, oh, PT can help everything, and it's all sunshine and daisies and all of that. It absolutely is not. We cannot help everybody. No single person or discipline can help everybody. So yeah, some instances. One that came to mind. It's a great question. Was we had somebody who had, it's an interesting story. I don't think I've shared this before. He came in because of an occupational incident. Was a construction worker. He was walking with a very, very tall ladder. He was walking backwards. He accidentally stepped in a pothole, and he got bent back. The ladder fell on him, and he bent himself back. If everyone can kind of get that imagery there. Really hurt his back. Pretty traumatic. Uh, the X-rays came back as actually not too bad. Some mild bulging of discs and some degeneration. So nothing that we can't work with. But the kicker with this is he was in the doctor's office after the X-ray. They were going to come in and do the interpretation or the findings. Not one, but three doctors came into the room with him, and they said, "Sir, I don't know how to tell you this, but your back is like a chicken bone." And the doctor actually made the movement of snapping a chicken bone in half, and he was like, "Oh my gosh!" And when he told me the story, I was like, "Oh my gosh!" What happened after that? He's like, "I don't know. I blacked out after hearing that. This is a true story." And I was like, okay. He was very amped up. I tried to have him do some diaphragmatic breathing and just some things. I'm like, hey, just hang out here for a second, dark room. Let's calm down. I came back in. He was kind of twitching and just like shaking a little bit. I'm like, sir, are you okay? He's like, yeah, man, I just can't get that chicken bone out of my head. And that was a very profound story for me because um, no matter what we did with this person, we could not relieve his pain and not like help him. And so I still think today this wasn't necessarily a structural issue, but more of a psychological issue that was kind of placed, in his head. Not that it's all in his head, not that he's crazy by any means. It's the what was placed into his head.
Hmm.
We couldn't help him. We ended up discharging him, and I believe he underwent surgery and all of that because we couldn't help him.
Yeah. What's actually really fast, or what that brings to mind. So the podcast that will have been released last week, um, which if you haven't listened to it, go listen to it. Super fascinating. It was a performance hypnotist, but in the conversation we were talking about how like for like someone who is just like I'm like, I needed you like 3 years ago with my ring muscle ups. Someone who is just like stuck in pattern after pattern, that like sometimes you can like basically hypnotize them to forget that pattern even exists, or that
Wow.
mistake even exists. And so I'm like, for me, like where I go with that is like just making that guy forget that that comment was even made to him, and how drastically that could have been different for him.
Yeah, wow. Performance hypnosis, that's super cool. Yeah, I mean, like that's what would have needed to happen, because there was nothing that was shaking that. They just have nightmares about this imagery. And so, I don't fault the doctors or anything like that. I'm sure they were trying to illustrate a point, but that point was not very well received, clearly.
Absolutely, absolutely. um
How about, yeah, sorry about that long-winded thing, but that just is in the top of my mind. How about yourself? What is
yeah, as a not fully mental one, as one really good example I had was when I was still working in the insurance world, but had someone come in like numbness, tingling in the legs, nothing out of the ordinary when we're talking like someone coming with back pain. But over time, like wasn't really getting better, kind of started getting worse. And then all of a sudden she fell off the schedule. I couldn't get in contact with her. Finally, she came back several weeks later, post surgery. And she's like, so basically she had gotten to the point that like the muscles were one getting weak, but two, she was just falling because the muscles were just giving out on her. And then found out like basically it was just pinching on the nerve more than they thought it was, and required surgery. So like things like that, where it's just like, you know what, you've tried the conservative route, you've done a lot of things, and like numbness and tingling is getting worse, pain's getting worse, it's causing you to like literally like your legs give out from you, like things like that. Like there comes a point of this is just on that nerve too much, and there's not much that can be done otherwise.
Yes, absolutely. Anytime, someone comes in with, the bilateral, and that's bilateral is both sides, um, numbness, tingling, weakness, all of that kind of stuff, that's a little inconsistent for something that physical therapy can help, Um, and we've had people come in who were like, yeah, I've actually lost 20 pounds last month without even trying. And it's great. My jeans are fitting better. And
Like, no, this isn't.
of course, yeah, I'm like, no, that's not consistent. That is, symptoms of something we can't help, particularly possibly cancer. So you need to go to your medical doctor to get that checked out. But yeah, we can't, nor do you and I ever claim to be able to help everyone. And at the end of the day, medications, surgeries, all of this stuff exists for a particular reason, right? And it's to help people, and it helps a lot of people out there. I know everybody nowadays is anti-drugs, but there's an indication for drugs sometimes, right? And at least in the, short term, possibly the long term.
Yeah, absolutely. And I think just kind of to continue on more of the like red flag stuff, because you did mention in passing earlier, um, I've actually had someone come to me with it, and I sent her back to her physician. But the like loss of bowel and bladder control is a huge red flag when we're talking about back issues and things going on. Because once that happens, like there's an area impinge that we, as PTs, we can't address, and it definitely needs to be more of a physician surgical intervention.
Yeah, absolutely. It's spinal cord, central spinal cord compression, which is no bueno, and needs to be intervened immediately. That's not a wait and see kind of thing. uh,
Definitely
but
not.
but that's why it's so important to make sure we're doing as thorough of an examination as possible. I actually read some research, interestingly enough, that was talking about how physical therapists are among the top healthcare professionals who are able to help someone. It's not diagnose cancer, but see that there could be cancer within them because of the amount of time we spend and the types of questions we ask. So we can help a lot of people. I'm sure the same is with spinal cord compression and all of that. If you do a deep tendon reflex on someone's knee and it kicks out and goes into clonus, that's not a good thing, and they need to go see somebody.
Yeah, I think it's a great point, just because it is, you know, the physicians may ask the right questions, but we spend the time with them. And even if someone's working with a personal trainer or a coach, like they don't have necessarily the medical background to understand what's going on with the body either when those things are happening. So that is a great point. Something I hadn't heard of, but it makes a lot of sense.
Yeah, yeah, it absolutely is, and so that's why I'm really proud to be in this profession. Like you said, it is the time, it's the questioning, right? When a typical person goes into the medical doctor, they're, and they say their knee hurts. The physician's just looking at the knee. There's, nothing else that really matters. If there's no other comorbidities on the, in their chart. But we have the great opportunity to, although we're working on their knee, we're talking about some of these other things in life. And then they tell us that, oh, wow, by the way, like, I recently haven't been able to make it to the bathroom several times, and
Hmm.
et cetera, et cetera. So,
Yeah, absolutely. Absolutely. Well, cool. Anything else on your mind today?
hmm, always stuff on my mind.
I know.
Um, yeah, it's relentless. You don't want to be in this mind. I want to take it from you. Um, uh, something that I think we've kind of touched on in the past is this whole like um, uh, conversation of the pain that you have, patient, is all in your head. You know, not, clearly nothing's wrong with you on the image, so it's all in your head. So get your head checked, or whatever they say after that. And that's a really hard one for us, or for me, um, to hear from people, because that has so many implications beyond, I think, what the doctor is really trying to say. Whereas pain is a very complex thing that has psychological factors as well as social factors as well as biological factors. But summarizing it all the way into it's all in your head, I think is a huge disservice to people. It's not just physicians I've heard this from.
Yeah. And I mean, essentially, it's just passing them off. Like it could be in their head, but it could be because of some like emotional trauma that happened to them years ago. And they need to go see a psychiatrist or psychologist who can help them with that. Like there's so many aspects that can be creating pain that aren't just physical. That, yeah, when someone's told that or just brushed off of like nothing's wrong with you, a lot of things can be missed to help someone's full well-being.
Yeah. And going to the point where, we can't help everybody, right? Like it's, sometimes a psychologist is in order because it is a manifestation of past traumas and all of that. Um, I know people who've had they've shared with me having some abuse in their childhood, and they were working through it, but then they got in a car accident, and all of a sudden they have frozen shoulder. you know
Mm.
um and we kind of see that sometimes as the frozen shoulder being a manifestation of all the trauma they've been through.
Yeah. Two fascinating books that if anyone's listening wants to read, or if you haven't read them, Matt, The Body Keeps Score is a
Love
super
that
good one.
title.
Well, yeah, right. And then the other one is The Emotion Code, which I've actually gotten that author on the podcast in the past as well. But The Emotion Code is another really good one.
Oh wow, that's awesome. Everybody definitely check out the Body Keep Score and the Emotion Code. I will get them on my to read list right after
Awesome.
this.
Yeah, super good books. Just kind of understand what both are to understand, like how the body holds trauma and what things can be caused of it, including pain. But the emotion code is actually cool because it actually walks you through how to actually like release that trauma and
Interesting.
whatever is like being held based on your past trauma. So it's pretty fascinating.
Yeah. Yeah, let's all remember that the body is such a complex organism, right? We like to say, oh, well, calories in versus calories out, or you do X to get Y, but we sometimes neglect to see the millions of processes that happen in between that A and that B
Hmm.
thing, right? And so I love that current research is trying to dive into a little bit more of that.
Yeah. Yeah. I just had, speaking of that, like kind of coming from a different direction, I just had someone message me recently, um, saying that they've noticed they've gained a little weight recently. Do you think it's because like the workouts need to be like intensity needs to be bumped up a little bit? And I'm just like, it's possible. But I said, there's so many factors that play into weight, like could be nutrition, hydration, sleep, stress, hormones, like a plethora of things. And like it really takes a conversation to dive into that to really figure out like what possibly is contributing to that issue.
Yeah. And for everyone listening, think of how cool that would be if you've had that stubborn body fat that just won't go off despite all your diets and stuff, and you could go talk with somebody for a minute, and that weight start to unlock and come
Yeah.
off, right? That's in my head that's an easy thing, you know.
It's
So
amazing. I've talked to several people who, excuse me, who work with specifically kind of those people with like yo-yo diets, yo-yo weight loss, and how much of that truly comes down to past traumas and emotional eating and things like that. Of like when something they don't even realize triggers them, it's like they go to that food or whatever. So it's really interesting for now that we wanted to get on to the weight loss topic necessarily, but how much of that is so like emotional based and trauma based.
yes, because we are creatures of emotion. We make all of our decisions, most of our decisions on emotion, no matter how analytical we think we are. Um, and there's a lot of stuff that it's just not we're not conscious of because we've been doing it forever, right? So that's the importance of having a team around you, having a coach, because we point this stuff out. We're like, oh yeah, you ever notice that? They're like, oh, I didn't, and now they're 100 times better because of one quick easy thing.
Yeah, absolutely. Absolutely. Well, awesome. Well, Matt, this was a great discussion today. Always fun. If
Yes.
someone wants to find you, harass you, yell at you, where can they find you?
You can scream at me at brienne.showman at just kidding, just kidding. I'd love to have a conversation with anyone who agrees. And if you disagree, I'd love to have a open chat in a respectful manner about this because we all have different opinions. You can find me on all social media. I'm at AutoNest Physical Therapy. You can also send me an email, info@antherapies.com. That's info@an, it's Alpha November, therapies with an IES.com. Love to chat.
Awesome. Well, this was a great conversation as usual. We'll definitely do it again.
Absolutely. Can't wait.